So welcome everyone that's joined to the September quarterly meeting for the Data and Evaluation Committee. It's nice to see people joining in. So my name is Kitty Foster. I'm the new data coordinator for Building Bright Futures. And if everyone just wants to put their name in the chat and connect it to their role and organization and also their location, if you'd like to add that as well. So for today's meeting, the majority of it will be focused on us building out the child hunger and nutrition security section of the Unified Early Childhood Data Development Agenda. We'll also have time for updates from members and guests on new and upcoming reports, opportunities for collaboration, and project and program updates. If you have to leave at 2 o'clock during this meeting, you can just share the updates in the chat before you leave so that you're able to share and then send them by email to be included with the notes. So that's just kind of the general overview of the meeting today. And Morgan's now going to share a bit more about the history and purpose of the data development agenda.
Hi all, good to see you. Good to see some of you on screen as well. So we're really excited about tackling some of these very large early childhood topics, moving through a workshop series to build something that we're calling a data development agenda. And what that means is we've recognized that there is no centralized place across Vermont's early childhood system where we have the ability to know at any given time what the data gaps are, what the limitations and challenges to existing data looks like, what data is needed to inform decision-making on different topics, any of the major questions or concerns stakeholders have about data, and whether or not that data might be publicly available, who has it, and who would be responsible for it if we needed it, right? And so what we have started to do over the last few years is start to say, yes, we understand there are a range of gaps and challenges. Let's compile that and centralize it in one place and call that a data development agenda. Let's have this be a living, breathing thing. Each topic that we cover, once we workshop it with the Data and Evaluation Committee or the team that's coming together to do the workshop series, that we will make it publicly available, not in a beautiful, finalized way, but in a very real, here is where we are, here's what we know about that discrete topic area related to data, gaps, limitations, challenges, opportunities, questions, all of those things. And so where we are in the series right now is that we've done a full workshopping session on universal pre-kindergarten education. We've done a workshopping session on early childhood education workforce, and more broadly than that, thinking about the early childhood workforce is on our list. And one of the things that we want to make sure that we are prioritizing at Building Bright Futures as the focusing in the childcare and education space. Our job is to build a very complicated system and making sure that we are building that allows us to tackle all of those different discrete topics. So today's and one of the questions that continues to come up for folks as we're building these massive documents of all of our questions and gaps and limitations is, what do we do next with those things? So just want to give everybody a quick sense that right now we have these two examples of the data development agenda. We're going to continue the workshop series over the next couple of years and into the future as we are tackling different content topic areas. But once we have 5 or 6 of those topic areas, the goal is to have subcommittees of our data and evaluation committee who are really interested in doing a deep dive into that topic area, be able to come together, not just our data stewards, but to also bring in additional research expertise and match those two things to say, okay, we know the gaps and limitations to some of our data. We know who has the existing data. How do we collect the data we don't have? Who has the content expertise and the skill to help us either write a grant to support that gap, or what systems can we put in place with the partners we have at the table, whether it's in state government or in the private sector or our academic research partners? How do we pair all of those skills, expertise to help build the systems we need to capture the data we don't have? And how do we do that systematically and continue to update this series of documents? So for example, when we did the workshop series on early childhood education workforce, we had this robust discussion of all of these different things that we can't answer and don't know. We had public partners there from our state agencies, we had private partners, and we had academic researchers help us build the list. We've already had some of our academic research partners use that list to help develop a grant to help support our ability to answer some of those questions. That's one opportunity. And another is to help support the state in building their capacity to capture the data. So today's session, again, is really focused on child hunger and nutrition security. There are so many opportunities to support the existing team of organizations and entities who are tackling this and really think critically about the gaps, the limitations, what data we have, what we don't, and then how to get it, which would be the next step. Anything that you would add to that overview, Dora, or any member of the BBF team?
I think that's a great overview, and we can definitely continue to explore questions. And are there any questions that are coming up from folks before we dive into the to this section? We can continue to please interrupt, ask questions as we are going through. So I'm actually going to share my screen, and we're going to just jump right in. And again, like Kitty said, we are going to switch over to updates and connections around 2 o'clock, maybe a little bit before. And but the bulk of this meeting is really going to be about building out this data development agenda section on child hunger and nutrition security. So I'm going to share one of my 17 screens.
And the link to this document is just got put in the chat for folks that want to be live in there.
Now I am having trouble. What are you? Nothing is showing up in terms of.
Not yet.
Okay. Let's try that. I had it on my other screen and it didn't like that. Okay. Are you now seeing the child hunger and nutrition security?
Yep.
So just a quick overview on the structure of the document. We have, together with support from Cynthia and Keely, identified some key topics, and just want to give a big shout out to both of them for working with our team to really come up with sort of what are these big buckets. Let's brainstorm, and then I think already filling out a bunch of the data. I have seen things that I think are coming from both of you. So each of these topics has its own separate table, and in each one we are looking at existing data, gaps, limitations, and challenges, opportunities, remaining questions, specific data to be collected, and then primary data entities. And again, I am so thrilled that we have already started compiling information, that it's already in here, and please continue to add in information in real time. We will also go through each of these tables, but you can add in information as we're going through. Again, just at the top of the document, we have information. The buckets are prevalence data, eligibility for all sorts of programs, utilization, cost and financing streams, effectiveness and outcomes, and connection to resources. Those were sort of the big topics that we identified. And if there are others that don't necessarily fit in, let's put them at the bottom. This is a living document. So this is our initial brainstorm. We have the people who are in the room who are able to make it today. So thrilled to have you here. And this is not the like, we are not finalizing. This is not in stone. At the end of this meeting, this really is wanting to be a living document. So I wonder if we can, we're going to try and spend an equal amount of time on these various sections. And so Jen, I'm going to ask you to help out with some timekeeping. We might need to adjust it a little bit. And really the first one is about prevalence data. At the moment, like so many parts of the early childhood system, we cannot tell the full story of what exists right now. We can barely tell much of the story that is happening right now. Keely and Cynthia, when we were meeting, we can't say how many children are currently hungry, right? That is like so key to understanding, and so that's really sort of the basic level of where we are, similar to many parts of the early childhood system, but that's really what this bucket is about. What is the current landscape? So I don't know if there are people who want to share what's in here. If you are on the call, we can also, was there somebody who was adding information about the study, the UVM study, who wants to share a little bit?
Me. This is Keely. Sorry, I have jets flying here in Winooski. But yeah, so these are a couple of studies that UVM did during the pandemic, and as well as the NFAC team did in 2022, kind of following up. And these are just like our most recent local food security reports that we have on the impact of food insecurity and hunger for different subgroups and different populations. And so focusing specifically on families with young children, which is obviously one of the group that we're focused on here, and just recognizing that this gives us numbers for food insecurity, specifically for families with children, and recognizing that subgroups, certain subpopulations of folks are just at more of a risk of experiencing hunger and food insecurity than other populations, including families with children in Vermont, women, people of color, and folks living in larger households. And although the first study that we're referencing is directly related to the pandemic and in that moment in time, we know that this exists outside the pandemic and was just exacerbated. Those numbers were just exacerbated with the pandemic. And then in the most recent study that we have, we actually saw food insecurity rates at about the same rate as they were at the height of the pandemic, in some cases even worse regionally, due to inflation, lack of transportation, housing, and all those other compounding factors. And so we found a lot more families with children reaching out saying, you know, before, and you can find this in the study, which is linked, that during the pandemic, they were actually able to make ends meet. They were able to use 3 Scores Vermont, WIC, and other food access resources to make ends meet. But with inflation, the cost of gas and fuel and other things, they're actually having a more difficult time, and as well as the ending of emergency allotments, they're having a more difficult time accessing food than they were at the height of the pandemic. So I just think those are still really relevant data points for us.
Thank you for going into that. I think one of the things that I'm increasingly understanding is that we may, like, I have this idea that we're going to have population level data about, like, really, you know, having this protocol, and we are going to be able to measure all of these things for every single child and family. And while these studies are, you know, based on a sample and a point in time, that they really are providing such key information. And yes, there are gaps and limitations, and they're not covering everything and telling the full story. But I really appreciate, you know, all of these data sources are so important, and it's what we have right now. I'm also seeing child nutrition program data and free and reduced price. Was that also coming from you, Keely?
I think Cynthia put it in there, but yeah, so a lot of times we were chatting. A lot of times that is one of the ways that we're identifying regions. And when we work with early childhood education programs, or when we're working in different regions, we are utilizing that region's free and reduced price rate for kids. So even though we have universal school meals, woo, families are still filling out school meal applications in a lot of cases, or a household income form, because of other funding sources that schools get. And so we're still able to use that data, that childhood nutrition data, to identify opportunities in those regions.
So quick question about that, and this may be getting too into the weeds, but is free and reduced price data based on income, or is it's an income
Yep,
measure?
It's
185% of the poverty line, or 135%. There's two stages.
Yes.
Okay,
Absolutely.
just making sure that it's that. Thank you. And is 135%? That's free, and then reduced would be 185.
You got it.
Okay. And those are really interesting things to think about and monitor as universal school meals comes into play. Cynthia, were you the one who put in food deserts as well?
I did, and I just a comment about free and reduced, and I know enough to be dangerous here, so not enough, which is why it's in there, and I don't own it. I just put it in that we want to watch this, but how child nutrition programs unfold in K-12 systems is very different than how child adult care food program unfolds. And so I think there's some intersectional data analysis that we could use assistance with, trying to figure out how do these two intersect, especially around universal pre-K and partnership organizations in the future, just to get a better idea of prevalence. And then I put in USDA food deserts, just again, thinking about one of the things I'm relearning and learning again is, hunger and nutrition security can be transient kind of conditions. People can move in and out of them for a wide variety of reasons. And yet, social determinants of health, so things like food deserts, housing, those kind of things, really can impact different stages of people's experience with hunger and nutrition security. So just thinking about what are those social determinants of health, and do we have data that can help us get a better foundational understanding of where prevalence might occur on any given point in time, because folks will move in and out of food insecurity. So food deserts is just one of those opportunities to look at social determinants of health data.
Great. And I think just tagging on to your sort of thread about what implementation looks like, especially around child and adult care food program, let's move into some gaps and limitations and challenges, and that might sort of overlap with opportunities in here. So I'm seeing gaps in age demographics. Again, gaps, like you were just saying, Cynthia, gaps in child nutrition program data, especially around schools serving pre-K children. Looking at, so it sounds like a lot of age breakdowns or lack of being able to do that aggregation or disaggregation. And again, like you were just saying, it's a transient experience, can be a transient experience. So thinking about all of these things and how they are intersecting in a child's experience and ability to thrive and family. Are there other gaps that should be called out here?
I think we've done some work on this, but neither Keely nor I put it in here. So Keely, I would rely on you too, and anybody else. I think there is still a gap about really understanding what the early care education system wants and needs. And so, addressing, I think, child hunger and nutrition insecurity systemically is kind of what folks at the tables I've been talking to are interested in, but how to do that, we still probably need some more qualitative data from larger samples from the field about what is it that they would like to do, and then what is it going to take to do that. So that's probably not prevalence per se, but it's prevalence in terms of it's not child level data. It would be sort of early childhood program level data around the prevalence of serving meals, not serving meals, and what they're seeing for their families. Does that make sense?
Yeah, Jen, I wonder if you can put that down in like utilization. I think that is definitely a gap that we are seeing. Sue, I see your hand is up.
Hi, yes, thanks. One of the other gaps that is very, very hard to manage, but I will just say it because it's come to light recently, is malnutrition data in the medical sense. There have been questions coming to the health department about levels of malnutrition, and it's clinical data, and it's hard to get. So, but I think it's an important data point that at some point we should be thinking about, is there a way to try to get that? And because I think that can only bolster this conversation about the long-term impact of malnutrition on kids.
Absolutely. And this is a place where this is not my specialty. And I was speaking with somebody about this upcoming meeting, and they were wondering about sort of overweight and obesity as well, that prevalence data, and if that is available in proxy or and I don't know the answer to that.
There's a small amount of data available. We are trying to move away from those terms because of the stigma attached to it and the damage and harm it causes. It's a health equity issue. And as a program, we are really, and WIC is with us on this, moving away from those kinds of terms and really looking at nourishment, appropriate nourishment and physical activity.
Are there other terms that we should be using? I'm just thinking from an outcomes perspective, right? Mm-hmm. Are there other terms as we're?
Well, data-wise, what we are always looking at is fruit and vegetable consumption and physical activity participation, meaningful physical activity participation. And that for this age group is probably lacking as well.
And Dora, just from my work with other national folks, nutrition security is kind of becoming that phrase to capture, I think, a lot of what Sue is talking about. It's, there's food insecurity, having enough calories, and then there's nutrition, which gets to the malnutrition, and that can be, people can be obese because of malnutrition, and they can be underweight and all those other things. So yep. I think nutrition security is starting to capture in that field, and folks I've been working with, kind of that idea that this is really about nutrition, not just food.
Absolutely. I appreciate that framing. And again, I think that this is a place where language matters so much. And I so appreciate that we have experts in the room who are able to guide this conversation. So I wonder, Jen has harassed me a few minutes ago that we need to move on. Again, just thinking if there are things that we need to that are missing, I would encourage you, like we already have a whole bunch of opportunities listed and remaining questions. I'm going to move us on to eligibility for different programs, and would encourage anyone who has more information about those opportunities, remaining questions, specific data to be collected, etc., to fill those in. So as we're talking about eligibility, again, we have a lot of program level data, and perhaps utilization is where we are going to have that program level data, but not necessarily sort of eligibility versus enrollment in some of these programs is difficult to determine. So I wonder if we can just talk a little bit about like combining all of these. What are existing data, gaps, limitations, and challenges and opportunities? Or is there a document? Like, Sue, could you point us towards a document that has information about that has more of the availability of WIC data? I know that there's like an amazing data team that's expanded a little bit with since COVID started.
I can't right this second, but I can look into it for sure.
That would be great.
On the call, I'm like the
perfect
WIC analyst. I work with Amy. I'm filling in for her today. I'm in the process of creating a external dashboard that'll be on the VDH site, and it'll have, right now what I have internally is food redemption and participation data and enrollment, but that should be up on the VDH site within the next month or two. So there's that as a source. Try to think what else. I'm working on some other things, but they're internal, like appointment summaries and things like that. But that might help fill in some of that eligibility and enrollment data.
That's wonderful. I really I'm excited to see that. I know that there has been sort of this challenge in being able to see, okay, we know the criteria for eligibility, but aren't necessarily able to get that full population because there are different challenges, and then being able to compare that with utilization. So I'm really excited to see even whatever comes up on that dashboard. But there's enough to go up on the dashboard is really exciting.
Yeah, definitely. Yeah, there's a decent amount of information on it right now. So hopefully it'll be helpful for someone. That was kind of the goal when creating it, was that someone was going to use it. So
I will be using it. Any other sort of existing data or gaps? I know that Cynthia and Keely, you were both again working closely on the meals and early childhood around CACFP, and like there's some data there, also huge gaps and limitations. And again, maybe just pulling that from the report, unless there's like a quick snapshot that you want to share with this group.
Well, I wonder about going to the Agency of Education itself and asking about eligibility, particularly sort of for universal school meals. I think one of the challenges that I've been understanding from my partners there is that when schools are doing eligibility determination, they don't carve out like 3 through 8 year olds. So this gets at that data limitation. They just know their percentages for like their whole school or whole school district population. So there would be some limitations, but I think in terms of the number of children that are eligible, you're a better data, you understand data in a way I don't, Doris. So I don't know, could we make extrapolations based on the school population that there are similar populations in early childhood that could be eligible for programs based solely on sort of their financing? I'm not sure. But I think that there's something around eligibility with the child nutrition programs that we could get some more data from. And then I'm also really curious, again, I have more questions than I do answers for most of this since I'm an early educator, but I'm really thinking about that sort of food is medicine group, CSAs, Veggie Van Go. Is there eligibility data? I see Sue shaking her head, yes. So is there eligibility data around those kind of programs looking from, I'm thinking of children with special health needs, or or any of that kind of piece. And so could we tap into any existing data around eligibility? I think that also helps us think about equity and inclusion in a different way and meeting every child's need, especially around children with special health needs. So is there a component there that we could tap into?
I work for the AOE and I know a little bit about FRL numbers and stuff like that. But if you have specific questions, I dropped in the chat. Her name is Mary, but she goes by Rosie Kruger, and she's the person to talk to if you have any special questions about that. She knows everything.
And I'm also seeing Dave Kelly is saying in the chat that information is is available at the child level. And again, I think this is a place where we don't currently have the capacity to be pulling and disaggregating data in all of the different ways. And again, to the point of like that, this data does exist and perhaps is around, like, is this the prevalence data, some of the prevalence data that we're looking for at the child level that, you know, Dave, I know that you have a whole lot of data. And is there a partnership? Is there a grant that we could write? Is there a researcher who, you know, we could create a data sharing agreement with, or, you know, a specific contract with, so that we could get some of this data? I think that this is a perfect example of the data actually do exist and we just don't have the capacity. So definitely,
Yeah,
James, you're gonna be like, don't throw me under the bus. Like,
no.
We can't even do that.
One of the things that we have trouble with at the state level is just getting the MOUs to get the data to talk to each other. And I heard from an ADS partner recently a great idea. I think it was from Indiana, where they have a data Switzerland that handles all the MOUs and is in the middle of all that stuff, so it can get all the data into one place easily. I don't know how we make that happen, but that sounds awesome to me.
I do.
Is that a data lake? Is that what we're talking about?
Kind of, sort of. I mean, that agency would be in charge of the Vermont's data lake. It would be a central place to get that data.
So you're seeing Renee and I get really excited because as part of the preschool development grant, we've written in specific additional agency data capacity, but also are working to move back into a space where we actually have something called Vermont's Early Childhood Data Governance Council, where all of those agency data stewards are coming together to figure out how to link and compile and centralize data. And the question that we are still grappling with is whether or not we are going to link data or create a data lake that is then you know, a place that we are able to cull some of these questions. So yes, Renee and I are on the same page in the chat.
In Indiana, the way that they were able to get this agency was to get the legislator to make a law to do it. So it needed to be written into law to get it done.
Don't threaten me with a good time.
Mm-hmm.
So I really appreciate this conversation, and I have to say I really enjoy this group and the fact that we can, like, we are so aligned about the things that we are excited about, and it just makes my heart sing. So really exciting to think about, to, you know, come to this realization. I could have made assumptions that yes, there's this data available at the child level, and again, the fact that now we know that it does. It's the question of, like, how do we get from here to there? I want to move us on. I don't know if there are other. Again, I'm going to invite you to put other information about eligibility into this section. I think probably, and then let's move down to utilization. And again, program level data is likely where we're, what this bucket is about. And I'm seeing, Cynthia, do you want to just in like 30 seconds talk about the dashboard?
Sure. So we worked with Nemours and Child Care Aware of America to create a child adult care food program mapping tool. It was focused on participation, so early childhood programs participation in that program, and yet it's a really cool GIS mapping visualization of a variety of data sets. So it includes child opportunity index, food deserts, poverty level data, and it literally maps where child care programs are across the state, and then gives some details about that. But it's an opportunity to look at intersecting data sets in a visual way to get a better picture of what's going on. And we'd love to update it when we can, and we'd love to include additional layers of data if other partners are interested at some point in time. So that's what it is.
And how can folks get involved?
They can contact either Keely or myself. The project is really on hold. It just came out in 2022, and we probably wouldn't update it until new Child Opportunity Index data is available, and they don't think that that will be available for another year and a half, I think is what they said.
That has been one of my questions about the Child Opportunity Index. So learning all sorts of new things. I think this is a place where, again, there may be, like to your point, Sam, about having a dashboard. I would assume that there is eligibility information in there, but also utilization. Are there other places where there's utilization data? Again, qualitative, like what are we hearing anecdotally about? I know there's a whole lot going on around that we've heard from regional partners about WIC utilization, and so are there places that we should look? Not that we have to laundry list all of the existing data pieces right now, given that we are already short on time. But are there data sources? Are there key data stewards that we that should be invited to add information in here? And also, yeah.
Sorry, this Keely, I was gonna say just food bank partners would be probably really willing to share some of the data about families accessing food banks and food shelves.
Awesome. Sam?
I was just going to say, we've been working closely with Vermont Child Health Improvement Program on a utilization food redemption analysis and project for a little while now. And I've been creating based off the working file, like our own file, because we didn't really have access to that ourselves. So we have kind of our own file that's in the works now that hopefully we'll eventually be able to, kind of provide information out to other people using our own stuff away from once this project's over. So that's kind of in the works. I'll probably have Amy reach out with more information on that, but yeah, that does have lots of things regarding WIC utilization on it.
Awesome. Yeah, VCHIP is such a great partner and is doing such high quality data work, and would love to be able to elevate that as possible.
And Dora, I was just going to follow up on utilization. I think this is one of those, it's program level data. So if folks haven't responded yet, if there's anything Keely and I am volunteering you, Keely, we can do to connect you with these folks to get them to add their resources in here, I think that would be really helpful, because I can't speak to 3 Squares or the food shelves and that sort of stuff, but they're there and we know that they contribute.
Absolutely. I wonder if, I think we will probably have a follow-up meeting about just like who are the people who should receive this, and a special invitation as experts and program folks, or maybe even if it's possible to put it down at the bottom of the document as folks are as we're going through these. So I'm going to move us on to and Cooper, I'm seeing your note in the chat about connection to resources. I'm gonna hold off on that until we get to down there. I wonder, one of the key things that is coming up across systems is really around different financing streams and costs, and you know, I think again, especially WIC is coming up with federal funds being up in the air. Are there places, again, we've got the Providing Meals in Early Childhood Settings report and the RAND report that came out last in January, December, January. And are there other places where we have cost data about programs or sort of those various funding streams? Our team, I think a year ago, has put together a first draft of an early childhood budget, and I think that there are places where are there data sources or publicly available information or folks who would be able to share some of how these programs are funded or what they cost?
Dora, can I ask a clarifying question? When you say what these programs cost, do you mean the discrete program like 3 Squares? How much money do we spend in that program, and where are those funding streams coming from? So it would be for each individual one, sort of each individual program. Is that what you were referring to?
Yeah, so I think that it's sort of both and, right? We have, like, I think it would be amazing to be able to even, and some of this may just be administratively, like looking at the federal data and then at the state budget, and potentially program level data. So yes, for each discrete program, but then I'm sure that there are also like gaps or shared administrative services, or you know, we have other systems that are again filling in the gaps. That Help Me Grow is not necessarily is not one of the programs that is only focused on nutrition security, right? And that's an additional cost to be able to support the system as a whole. So I think it's both and. Does that answer your question?
Yeah, and I struggled with this one a lot because both federal and state budgets change annually, whether, you know, policy changes annually. It's really hard to answer this question. And then there are, of course, all of the sort of additional factors like that can impact, like employment rates. And, you know, we had record level heat in the Southwest, which might impact food supply chains, which might impact rising food costs. So it's just one of those, I know I'm spiraling out, sorry, but this is how complicated this is and the transient nature. And so I'm just trying to get a handle on why would we collect this data? What is this going to help us advance? And is it a cost thing, or is it I'm coming up, I guess, with my own, like, is this a philosophy thing? Like, people should be well nourished. And so cost to some extent, it's not irrelevant, but how much time do we spend here looking at evaluating this if there's not a lot we can do about it? I guess is what I'm trying to say.
It's such a great and important question, and appreciate you going down that rabbit hole, because it all is all interconnected and so important to be asking the question about, like, why are we collecting this data? What are we going to do with it? Renee, I see your hand is up.
Yeah, I also think it's a great question, Cynthia. As you were talking, what strikes me is this pairs with maybe it's the next one down around outcomes. And like for me, it's that thought, how much are we spending? And is that really an effective way to be spending the money? So I guess I do kind of black and white it back to what is our investment in SNAP? And because you're right, those food costs, like those pieces, those are out of our control. But how much within our control in terms of our budget and our priorities that we set, you know, how much are we spending there? And then how does that sugar out in terms of the outcome is the way that I'm kind of conceiving it.
I appreciate that, Renee. I think it's like literally that cost benefit analysis, and we need to know the cost part. And you know, to a certain extent, we, you know, goal 4 of the Vermont early childhood system is like well resourced and integrated, right? Those, and are there places where we can create alignment? And if we don't know where the money is coming from and going, then we can't sort of think about opportunities in the same way. And again, to your point, Cynthia, about like where are we spending our limited time and energy and capacity is a really important one. Valerie?
Yeah, thank you, Dora. I also think about while this data might be challenging to collect regarding funding streams, it's also important to identify which funding streams are more sustainable and which are more temporary. And I've heard a lot of people talk about, you know, the transient nature of hunger, transient nature of food costs, and some of our funding streams are also transient. You know, referencing the VIPB5, that's a 3-year effort. So if some of those funding sources are to go away, how do we plan for sustainability?
Thanks, Valerie. So I am going to continue down. We have 2 more: effectiveness and outcomes and connection to resources. And Renee, I'm going to call on you about your question under outcomes. Maybe. Renee, did you have a question? Uh-oh, she must have stepped away for a minute. I think this is, again, one of the most difficult pieces, right? We talk about Vermont is really good at measuring counts, and it is really hard to measure outcomes and impact. And again, we do a really good job of and I think Cynthia, you are such a great proponent of using qualitative data, especially around outcomes. And because all of these things are so interconnected, we can't say that one thing is specifically because of like this discrete intervention. So I wonder, again, as we're talking about existing data on effectiveness and outcomes, and is there existing data that we should be highlighting, qualitative or quantitative? And Renee, okay, you're ready, go. Maybe. Renee, jump in when you are ready. Anyone else?
I'll just offer that for me, this is where the intersectional relationships between the data sets could be really helpful. It's very difficult for us from a big, and again, early childhood lens, like programmatic lens, to know whether or not a family is receiving the type of support they need, you know, how effective is that particular support, 3 Squares versus SNAP Ed versus can I participate in child adult care food program and at least focus on the child? And so those qualitative stories become important. I also think that the intersectionality of these data sets become really important here to understand the landscape, so that when we get to that question about what outcomes are we receiving for the investment we're putting in, we have a better way of describing that. And it's why I go back, you guys have heard me say, I love the data governance, and the data lake just is fantastic. Let's have a data lake, because that might help.
Thanks, Cynthia. Looks like Renee is having a lot of trouble, so we might have to. So let's. I hate to cut this part short, but let's move down to connection to resources, and then if Renee comes back, we can go back. And so Cooper, I wonder if you can talk a little bit about what Help Me Grow is collecting and the limitations.
Yeah, I'm happy to. So I guess what I put just in the chat there was we do collect information about connection to resources, and we can narrow that information down. So we're just looking at clients that we have referred to food resources. Of course, there's a lot of overlap. Like it's rare that a client calls for just one thing, right? So we might be looking at a client who's called for food and called for something else as well. But in terms of, connection, we do track it. But the thing that we come back to again and again with looking at this data is that often, it requires the client to follow up, right? So if we talk to the client twice and then we never hear from them again, we can't track what happened. And I get the sense, anecdotally, that a lot of what is happening when we don't hear back from a client is that they got connected and they simply were like, well, I don't have to pick up this phone call anymore because I got what I needed out of them. And I think this poses a huge challenge for our connection rate, and really limits what we can say about connection. And this is true for all areas, but I think just in particular with food, I feel like I do feel like we're drastically underreporting that connection to food, because from what I can tell anecdotally, that's one of those areas where people are most likely to actually get connected to those resources if they were actively looking for that information.
I appreciate that. And thank you for sharing the limitation. Again, it is so, we don't want to be collecting data for collecting data's sake, and doing like so much tracking, and to be able to, and it's difficult to sort of put this out and then not know if that connection is actually happening. And I think that we could probably track like what trends in referrals and trends in use of meal sites and food shelves, et cetera. So I wonder if there's an opportunity there as well. I am going. Are there other things to share about any of these topics that we need to address before we just quickly wrap up and then move on to updates? Again, this is a living document. It is so important, and that this really is. There were so many key people in the room that are in the room right now, and there are also so many people who are missing. Emily, I see your hand.
Sorry, I had a thought. So I'm wondering about how we are tracking these data across different levels of our system. And it sounds like a lot of the conversations have circulated around, tracking outcomes for the individual or the community. But I'm wondering if there's room to maybe include some consideration for those larger data points, such as the policy analysis. What policies are being elevated at the legislative level, at the national level, that could have an impact on funding streams towards this issue, or new laws being passed, even at the regional or county level, if policies are being implemented at that level. It might be a point for consideration and how we're looking at these data sets and what data we are considering to be useful.
Absolutely. I think that it is. Yeah, I think, Cynthia, back to your point about transient funding streams and all of these policy changes, that as we're looking at trend data, that we are able to say, like, here is where that change happened, and here is, again, not necessarily getting exactly to outcomes, but that these are significant. It's not just about, there are so many external factors. We will, so wrapping up for right now, we will be putting this up on the Vermont Kids data next week. And I wonder if folks do have an opportunity to write down any contact information, data stewards, key partner contacts at the very bottom, or send them to me by email. Then we can reach out specifically asking for their input. We are still deciding what the next section of the data development agenda is going to be, and that'll be in November or December. If you have feedback, please put it into the chat, or we can reach out feel free to reach out as well. And I know a lot of people are going to have to jump off. If there are folks who, feel free to put an update in the chat, or send it, and we can put it in with the notes. Thank you to everyone who has been here. Thank you, Keely, for being here. I really appreciate it. I wonder stepping from sort of a focus on child hunger and nutrition security, let's back up and just broadly thinking about early childhood data and data systems, big updates, surveys or data collection, thinking about upcoming reports, utilization of data. What is going on that we all should know about?
And just put all those prompts in the chat too, because there was a lot of them.
Katie, go for it. I was going to call on you.
Yeah. I just wanted to note for this group that Let's Grow Kids is starting to develop the next process for analyzing the stalled at the start report data and our access report. So those are in the process of development, and just wanted to note that for everyone here. Thanks.
And for those who are not as familiar, stalled at the start is supply and demand of childcare.
Yes, exactly.
Awesome. Any other things that are coming up?
I can throw in that we just went through some planning phases with a larger group, but we're kind of like completely revamping our annual WIC participant feedback survey. I don't know exactly when that'll be done, but we're going to have the survey be a little bit different this year around, and we're thinking of having a clinic satisfaction automated survey also now. And we're also working on a photo voice for some qualitative data. I think we just did interviews last year, but that's in the works.
That's great. I think that data collection at the client level is so important. Tiffany, I'm seeing your note about the Division of Racial Justice Statistics, and I wonder if you can come off mute if you're available and just quick blurb.
Hi there. I'm so sorry. I've been running and it's been quite a day, and I came back from a conference yesterday. So, but it's really exciting to hear what you're working on. So we have launched the Division of Racial Justice Statistics. I think we have an initial focus on issues of criminal and juvenile justice, and just looking at the various systems that impact upon those systems with the lens toward equity. So right now we're at the very beginning stages of thinking about data integration. We do have a lot of reports and frameworks that inform what we need to do. So I don't feel like we're starting at scratch, but we have a lot of work to do, and a lot of it will entail bringing data together from across different agencies, and a lot of collaboration. And I think you all are doing some really great things with regard to childhood issues. And so I think as we're looking upstream, I think a lot of what you're talking about will have implications for the kind of work that we're trying to do. So I want to thank you. Yeah. And I was on I attended the conference that you had, the virtual. Oh, it was really good. Really, really good.
Yes, I'm so glad that you were able to attend. So this was our first early childhood grand round seminar on data equity in early childhood data. And it was really powerful and really came out of this committee. So there is a recording up. There was an email that went out a little bit earlier today. And we had three really strong panelists, national experts coming in and talking about demographic data collection and talking about the sort of key things that we need to be considering, and what is the most meaningful sort of focus, and that things are never straightforward. And again, this really did come from this committee, from our policy recommendations that were endorsed from the State Advisory Council on reducing inequities in demographic data collection and reporting, and then came together to talk about, like, what does that really mean in terms of moving those forward. And then sort of came up with this. So we definitely have some follow-up work to do. We have not checked off the list, and I think that's what our December meeting is going to be focused on. How are we taking the information that these national experts shared? How are we really living into implementing those policy recommendations? So we couldn't do that. There wasn't enough time to take but over the last week to put together a really meaningful agenda about what that looks like. And we'll spend, and we really needed to focus on this data development agenda section. And we'll look forward to doing that in December with this group.
That's excellent. Thank you.
Just in the chat, I want to note that CDD is not quite yet ready to release the workforce report, but that it's almost there and has been solved. But we should keep an eye out for it.
Thank you, Dora. That's exactly right. We're nearing the finish line, but the people who need to give it that final approval still need a little bit of time with that.
It's a key step. Julie, do you have an update?
I'll just mention, I'm sure you all saw that the poverty measures came out last week, and we saw that nationally the supplemental poverty measure shows that childhood poverty is up quite a bit with the expiration of all the expanded federal child tax credits, the economic impact payments, and things like that. I don't think they're going to be specific state supplemental poverty measures. I don't know if anyone on this call knows differently than that, but we're keeping an eye on that and hoping our state continues to do more with their tax credits that exist.
And I'll piggyback on what Julie was saying, because I had it in the back of my head. I was trying to find it. Just so folks, if anyone's interested, the National Academies of Science, Engineering, and Medicine are hosting a webinar on updating and modernizing the poverty measurements to go along with exactly what Julie was just talking about. So it's Friday, September 29th, if folks are interested in hearing about that conversation.
Thank you both. I thank you both for sharing. I don't know what else to say. Carly, I see that you just joined, and I'm sure you're coming from another meeting, and we're doing updates, and I'm gonna ask for the update that I always ask you for around the new data system for family services.
Hey, I was prepared, Dora. I knew I was coming in late. I knew I was gonna get asked as soon as I got here. Yeah, I apologize. I was quadruple booked today, so I'm happy to at least catch the very tail end of you all. So Carly Tebow, Family Services, part of the quality assurance team. And what Dora was just referring to is what we are trying to do, which is bring on our new data collection system, CWIS, or the Comprehensive Child Welfare Information System. Vermont Family Services has the oldest data collection system in the United States in terms of child welfare, and that's not something we are proud of. And it's $15-ish million to get a new one. So we are further along right now than we've ever been in the past in terms of actually making this a reality. And right now, we are working on the final draft of the request for proposal, the RFP, that will go out to vendors. So right now we're doing an internal review of that. Once that's complete, probably by the end of this month, very early October, we'll then send the kind of final draft version to our federal partners. There's a federal requirement for the liaison to review it for all states. Once we get their sign off, we'll be able to send it through another internal team here that has to do the internal sign off. And then we would be able to put that out for vendors to begin bidding on. So for us to then select which vendor to use for our system. So in terms of the process, we're going pretty well. We also just found out that we were able to keep the carry forward funds that have been allocated to CWIS. So right now, there's actually no money allocated to CWIS in our budget. We've tried, we've not been successful. We're going to keep trying. Instead, we have money allocated to us through like vacancy savings over the last few years, that kind of thing. However, it can be swept every budgetary cycle. We have to continue to fight to keep it so that it's not pushed into, pushed towards to something else in the Agency of Human Services. So we had to fight really hard this time because kind of, how long things were taking and where we were at, but we were successful in that. So that's about $4 million. We also have federal match. So we have just under 10 million, but again, not guaranteed funds and not enough. So really kind of at the same time that the core team is pulling together the RFP, some of us are really working on financial advocacy, and we're getting some traction there. We actually had a judge who's pretty high up in our judiciary connect with our deputy commissioner at a conference last week and indicate he would like to partner with us in brainstorming. He would like to testify in front of the legislature on our behalf, which is kind of what we are needing right now, is folks who can really help speak with us and for us. So we're just getting creative around that, because we know we're going to need more, and we would like for that to actually be in the budget and not have to worry each year if we're going to lose that money. So that's a big update on our end. Hopefully by the next data meeting, I'll be able to share that the RFP is out there.
Awesome. I know these are really long projects, and it's great to hear that both that funding has not been reallocated to other programs, and that, again, this is the furthest along that it has been in the process. I forgot to mention that, or I sort of mentioned the policy recommendations, but the State Advisory Council did look at a draft slate of recommendations around across the board, and included several data recommendations, and including system infrastructure, and both CDDIS and with a Children's Integrated Services model, as well as CWIS, were specifically called out for sufficient funding. So just want to, those have not yet been endorsed by the State Advisory Council, but those, but there will be a vote on October 24th, I think, whatever that Monday is. 23rd. No. I can't find the date.
Yeah, no, we're very appreciative of, like I said, having as many of our community partners and providers and just partners in general supporting us in this way. And I think it's really, we're seeing the fruit of that. We're seeing additional people come forward, hearing about this, hearing the need, and starting to get interested in supporting us. So it's looking positive right now, and it hasn't always.
Absolutely. Other updates? Valerie.
Yeah, I'll just take a moment to mention that as the lead evaluator for the VIP B5 efforts, a lot of the work of this committee intersects with those efforts, either directly or indirectly. And so just an update that I'm in the process of meeting with the teams that are responsible for implementing the activities that we had in our work plan, and really meeting with teams to provide evaluation, consultation, and technical assistance about the specifics of moving from the overarching goals that we have with that initiative towards the specific activities, when those activities will be implemented, and then landing on agreed upon metrics that measure both process and outcome measures. So that work is proceeding, and it's proceeding across different timelines with different teams. Some teams are a bit farther along, and that's okay. Some of the teams are much larger than others, and so you can imagine scheduling can become an issue. But I anticipate drawing from some of the documentation of the work of this committee to help make sure when I'm meeting with those teams, if there are things that have been identified in the data development agenda that might seem relevant to those conversations, that I'm pulling that information in appropriately. So I appreciate everyone's contributions to the conversation. And if you have specific questions or like more detail about any of that work, feel free to put your question in the chat, or you can follow me via email. Thanks.
Thanks, Valerie. And just want to say, when Valerie talks about different teams, there are 18 different projects that Valerie is providing technical assistance to, and range from, very, very small discrete projects to data integration. So thank you for all of that work. Any last updates? I am going to then pass this over to Jen, who's our new data manager. Right, data manager. Sorry about that. Who's gonna just wrap up our meeting.
Sure. Yeah. Thanks everybody for joining us today. I think we had heard a lot of great conversation and ideas about moving forward the nutrition related data agenda. We're going to send out notes later about all of your updates, and please continue to put things in that shared document that we were working in today. We have a quick meeting feedback form that I just put in the chat. It's just an ideas board. So with 4 questions about your takeaway from the meeting today, suggestions for upcoming meetings, changes you'd like to see, or highlights that you think need to be elevated for policy recommendations as a result of what we talked about today. So if you have a minute, love to hear your feedback. Otherwise, so nice to see some of your faces and get to know folks a little bit more in the context of our shared work. Anything else, Dora?
I just want to, one of the things that we've been trying to do across our network meetings is to sort of highlight throughout the year anything that could be elevated as a policy recommendation or consideration. And one of the things that I heard a groundswell around was that data integration, data lake piece of things, to be able to have that data Switzerland that James mentioned. So I think that that was one of the big just overarching considerations that might be elevated as we're informing recommendations throughout the course of the year. There were so many more that were around the data development agenda, and also and just again trying to think sort of big picture. That was one of them that I think would help. So yeah, I think that's what we've got. Oh, Tiffany.
Oh, just question, as you're mentioning the data lake, are you working with ADS at all on that effort?
So complicated, and yes, we are eventually. It is an ongoing conversation, and I don't know if you are also participating in similar conversations. I think a lot of times there are parallel conversations happening, and so again, part of why we convene this meeting is so that we are aligning those and having broader conversations.
I would love to cross-reference or do some kind of cross-collaboration, because we are contracted with ADS as we're collecting the data sets from various agencies, and we have discussed their data lake.
Tech issues. It looked like Tiffany just dropped off, and clear follow-up action item for our team to connect with Tiffany's team at the Division of Racial Justice Statistics. Anything else? I think a lot of people had to drop off at 2 o'clock, and really appreciate everyone who is still here and those who had to leave. And we'll meet again on December 21st, which is an iffy date, but hopefully you all will be there, and we'll talk more about what moving forward policy recommendations look like, and following up from the Early Childhood Grand Round Seminar. Okay, thanks all.